We are here from Be the First Step, and we have an exciting webinar to talk to you tonight, and it is BioMedical. So I'm going to let Dr. Laura get started.
Because this is a pretty intense topic. And again, we are only working on a little bit of information on our Wednesday webinars, and we're leading up to a summit full of lots of information, very detailed, and we will keep you informed as we are able to put our summit together. But just to kind of give you some information and to bring about some information to help you realize why this topic is important, this is what I'm going to focus on this evening. I want to give you a background. Why biomedical labs? What are biomedical labs? So there's such a difference in our healthcare system about labs. For years, even myself, when I first started practicing, I did things where I would have you try this supplement, try this particular food, try this diet. And what I learned over the years is that it took people, lots of people, long time to be able to ever get any kind of results. Well, you know, that's one of the issues in chiropractic in general, because we are doing things, healing the body, and it does take a while. And in our culture, we want to do everything as quickly as possible. So of course, wanting to be a good provider, I myself started looking at what can I do to be thorough, really find out what's going on with that particular person's physiology, and then specifically address it. So biomedical labs or functional labs is a way to look at your physiology, your child's physiology, and truly identify what are their personal needs. What might be right for me may not be right for you. So we can't necessarily do the same things. And one child may need a certain kind of diet while another child may need another type of diet. And the only way to truly know what you need is through labs. Now, keep that in mind for just a minute, because you guys have already figured out that Donna and I work with developmentally delayed children. Well, we want to go even farther and get to couples before they ever conceive. So if by chance you know somebody right now that's either planning on having a baby, thinking about having a baby, the time to really do those biomedical labs are before you ever get pregnant. Because if we remember things that we talked about in the previous week, we would go through the histories and we would be able to identify on those moms endocrine issues, adrenal issues, gut issues. And then if this is what's going on in her internal body, then yes, that is going to be part of what is passed on to the baby. So biomedical labs really have a very valuable place for preparing to have a baby. Now, most people are probably coming to us right now because they already have a child, not necessarily planning it, but I definitely want to put that pearl into our discussion. So we will focus more this evening on talking about your child and yourself. What can you do biomedically, and why is this important? There is a difference in a lab that you would go traditionally to your doctor, your medical doctor. And let's say as a woman, you might have some adrenal issues, you're tired, you're fatigued, you notice some skin dryness, you've been reading, you've heard from friends, maybe something's wrong with your thyroid. You'll go into the medical provider, and if you can, get them to run the labs. That's the other issue that's becoming quite a problem because of what's going on with managed care. Managed care is looking for only to be able to get reimbursements, and if you don't have a real reason to get that lab, you're not going to get it approved. Now, somebody like me, I don't have to go through that red tape. I can do functional labs, but they are going to cost money out of pocket. There are some insurances that at least would give you a little bit lower of a copay. But I will tell you right up front, they do cost money. It's not like walking into a medical provider where you have a traditional insurance card and you're going to pay a $10 copay. But why should I ask you to put forth that money? Well, because the information that we get from those labs is so valuable. You are not compared to averages. And this is what is happening in allopathic labs. Every year, statistically, they go through and they look at all the labs that have been conducted, the gender, the age, and they determine where the averages are. So they're changing biochemistry. Biochemistry doesn't change. So you are being compared to nothing but averages. And the majority of the time when the women go in there and they want their thyroid checked out, the results that they are getting, they are still falling in that within normal limit. So the medical provider says, you're fine. And you go off and you start to continue that hamster wheel on chemistry. So we can have a hamster wheel mechanically, emotionally, and chemically. So then you might try it again, or you might hear about BioMedical labs. This is where they are going to look at biochemistry. What does it take the human body to run? Looking at you as an individual. So in my practice, one of the things that has been so alarming to me, and I promised that we were going to talk about cholesterol, and I really want to bring this up because this is an area that most people just really still don't understand, that there has been, over the years, about 45 years, we've been driving cholesterol down. In my practice, 99% of the children have low cholesterol. So that's just about everybody. And then when I go and I look at mom typically has low cholesterol as well. Excuse me.
Because we've been trained to
Yes.
think in terms of low cholesterol as it relates to heart disease.
Exactly.
Mm-hmm.
And so there is a great documentary out there called Statin Nation, and that will address all that information about looking at cholesterol and connecting it to heart disease. But you would be very surprised the information that you're going to see on this documentary. Cholesterol is needed. It's a carrier molecule. It is not going to generate the plaque on the arteries as we have been taught. That comes from damages to the internal structure of those blood vessels, which the number one culprit for changing the integrity of the blood vessel is stress. When you have a stress response, you have a physiological reaction. You change blood flow. It goes from the front of your brain, where the frontal lobe is, executive function, over here to the hindbrain. And the two messages that you get are fight and run. So the body is preparing either for battle or for running. And that changes because the circulatory system is very involved in those physiological reactions. So it's actually changing the integrity of those vessels. Now, when you're a baby, your brain, the majority of it is fat. Well, cholesterol is fat. Cholesterol is needed to make those neurons so that you can make connections. I've been talking about cholesterol now for at least 15 years. And still I have people look at me and they're nervous. Could this really be something that I should look at? Well, where the total cholesterol value should be is around 225 milligrams per deciliter. So one of the labs that I use, I have a phlebotomist. She'll go to the patient's, the parent's house, and we will do the blood draws. So we do a fasting cholesterol because we want to get a really solid number, what the total cholesterol number is on every single child. But what we've got to understand is that there's many factors that are changing how cholesterol is actually working and being produced in the body. So one of the biggest areas that affects how cholesterol is manufactured in the body is the liver. Now, you wouldn't think that a little baby would have trouble with their liver, but I don't know about you, but there's lots of little kids. I've seen them as young as a year, maybe even younger. Yes, in fact, I worked on one a couple of years ago. She was actually only about 7 months old, body covered in eczema. So here's your skin. Your skin is a filter. Your liver is a filter. If that system is congested, then your body's got to go to another filtering system to get this stuff out. That's going to be your skin. Now, eczema is not limited to cholesterol levels. Nothing is typically a one road path. In fact, it's multifactorial. And that's why we're bringing in the idea about food sensitivities into this particular broadcast, because the condition of the gut plays a huge part in how that body would get such a burden on the liver to begin with. Now, let's kind of back up a minute, because I really want you to get this. If you don't know your state of health at the time of pregnancy, meaning that you literally had biomedical labs done and you know the function of different parts of your physiology, then you conceive a baby, then whatever goes on during that pregnancy, and now that baby is born. Now, at the birth, there's a lot that happens with Pitocin. Pitocin is synthetic oxytocin. Oxytocin is actually a neurotransmitter hormone of the brain. It is what is responsible for relationships. Now, when I say relationships, it's between friends, it's between husband and wife, it's between you and your community, it's between peers, it's multifactorial. Can you read facial expression? Number one thing that's brought up into the population of autism. Kids usually can't have the appropriate facial expression. They can't read. Donna really discussed a lot about facial expression last week. So when I look at that history, I want to be able to find out, was this an induced labor with Pitocin? So Pitocin is synthetic oxytocin. And what happens is that it changes the integrity of the neurohypophyseal stem, which is part of the pituitary gland. So now we've got endocrine system, because that's the pituitary gland. We've got the influence on brain hormones and neurotransmitters, so that's brain function. Endocrine system is also going to be communicating with the liver, because your liver makes hormones too. So the big picture to understand is that it's layer upon layer upon layer. And this is why when we get a child that has some type of diagnosis, or somebody would give them a diagnosis, this is why it can't be a cookbook, because no child is the same. No histories are the same. There might be some similarities, but there are huge differences in every single child that I've ever worked with, and I'm sure Donna would agree. So this is one component of cholesterol. Cholesterol is needed to help the brain grow. It is a carrier molecule. It is going to carry the nutrients to the brain. It is going to carry information throughout the rest of the body. There's a G protein related in cholesterol that is responsible for integrating the sensory motor system. So babies' brains, when they are born, the majority of it is fat. And the first constituents of breast milk are fat. So fat is needed. And we live in a culture, well, my goodness, even Cheerios lowers cholesterol. We are constantly trying to lower people's cholesterol. So when we do labs, we, of course, try to keep everything as reasonable as possible. And so we will go and utilize, through our phlebotomist, just a traditional lab report that will tell us what the total cholesterol is. So I don't use a functional lab company for total cholesterol, because most of the time the families that find me and want to start going down this path, the resources are very low, and we want to try to save money as much as possible. So we can take a test, if I go and do it through a kit that may cost $200 to $300, we can bring it down to a $50 charge. But what's interesting, and I always warn my parents when we do this, what you are going to see on this lab report, it is going to say that the cholesterol is normal when it's 100 to 169 milligrams per deciliter. That is low cholesterol. Cholesterol needs to be around 225 milligrams per deciliter. There are many other factors that play a much higher risk on heart disease than cholesterol. And again, I encourage you, especially if this information just seems, how could this be true? Go look up the documentary Statin Nation. You will see it's a medical community that has come together. There's a big shift that's starting to occur in the medical community regarding the use of statins and lowering cholesterol. So let me just give you the nugget with that one. The elderly population is typically put on statin medications. Their cholesterol is driven down in that 100 to 169 range. So guess what? Most elderly people suffer from depression. Okay, they don't have a lot of drive and motivation, right? So why is this? Well, low cholesterol has the same risk factors as high cholesterol, with the caveat of depression. I also see children that are depressed. I also see children with oppositional defiance disorder and autism with language delay. Those three populations, typically every one of those kids also have low cholesterol. Now, this leads me into the food sensitivity component. So why do food sensitivity? There's a lot of information out there. There's a lot of people that'll tell you to do it. There's a lot of people that'll tell you that it's not reliable. It is a tool, and we can definitely use it. I use it every day in my practice, and I have absolutely seen children resolve the issues that they come in with because we are looking at their diet. The number one reason we want to look at the diet is many different factors, but one is biofilms. We started talking about that in a previous webinar, which we will really dive in the summit. Because when we have pathological biofilms, you are actually craving foods. And most of the time, the foods that you're craving are going to come up on those outcomes of those food sensitivity tests that you're either allergic to or sensitive to. So what happens is you're hungry. These pathological biofilms are intelligent. They're going up and sending a message to the brain, feed me. Not only feed me, but I only want you to feed me crackers, bread, corn, milk, French fries, pizza, macaroni and cheese, all those types of complex carbohydrates that if we look at any kid's menu when you go out to a restaurant, every one of those items are on there. And the thing that the child typically stays away from is the hamburger that's actually on the bun or the hot dog that's actually on the bun, because they can't break down the protein. So if you're a child, or you know of a child, maybe you see this, you're a teacher, and you see this in the classrooms or in the lunchroom, that these kids don't eat their lunch. They specifically don't eat the protein. That is a huge sign that this child can't break them down. If I can't break them down, I've already associated, keyword in brain function, association, that when I eat this particular thing, I get a stomach ache. So they're going to avoid it. Just like if their balance is off and they're afraid that they're going to fall off of a bicycle, they're going to avoid a bicycle. So when a child avoids something that they should absolutely do, that is a red flag. Now, what's the difference between food sensitivity and food allergy? So your allergy is going to be what's called an IgE immunoglobulin. This means that you are allergic. This means that you go into a full-blown inflammatory response inside of your body. An IgG immunoglobulin test will indicate that you are sensitive. Allergies, you've got to stay away from forever, unless you've had probably, depending upon the age. To me, if you had an allergy, I would just say take it out of your diet. But I have had families come back and say, how long? I would tell you at least a decade. Every time a child is going through a cycle of growth, you have cellular memory. These things are going to come back up. So you've got to just stay away from them. The reverse on the immunoglobulins for sensitivity, we could be looking at 6 months to a year, because the key with looking at these tests is we want to reduce inflammation. Inflammation is the culprit. You never go into a pathology without inflammation. None of these kids have a diagnosis of autism, Asperger, ADD, ADHD, ODD, PDD, whatever the diagnosis is, or if you perceive that this child would get a diagnosis, every single one of them have inflammation. Just like if you're an older person, even my age, if you're going to get diabetes, autoimmune, endocrine, depression, any of those elements, inflammation is going to precede the problem. Then you've got blood barriers inside of you. They're in your gut, they're in your respiratory, they're in your brain, and this inflammation leaks everywhere. So really, there's a lot of research out there that talks about autism is actually brain inflammation. ADHD, we will get into those labels in detail, but the same thing is true. When you have a child that's their glucose is not balanced, they are literally borderline hypoglycemic, and then when they go after this craving of complex carbs, they will load the system so fast, so quick, that they can't get the insulin to use it up fast enough, which is going to make it spiral, go into hyperactivity. Now you've got a child when it's about the inflammation in the gut, and this kid has a label of ADHD. So that's the value of literally looking at a food sensitivity profile. Now, again, the same thing is true. If you go into the allopathic doctor and you want to use your insurance, they're typically only going to look at about 6 to 8 of the foods. They won't give you broad panels. So we're able to look at like 25 IgE, and we can add as many additional foods as we want. We can look at panels for sensitivity anywhere from 184 all the way up to about 300. So there's lots of variances that we can look at to really appreciate cultural backgrounds, the way people are eating, if you find yourself eating more fast food compared to being able to cook. This one other test that I have also looks at the chemical sensitivities and molds. So it's not limited to just the foods that you eat, but it's also the air that you breathe, what you're putting on your skin, what you are being exposed to on the inside and the out. This is the only way that we can actually look at what do we need to change. Then we couple these food sensitivity and cholesterol with things like a vitamin mineral. It is completely a misrepresentation that you can eat enough food when you have a deficiency in core vitamins and minerals. You can't do it. You must do therapeutic levels of supplementation to bring up those areas. Think about it for a minute. If the kid is constantly getting stomach aches or breakouts, you can't get enough food in their body. And then we can look at the stool test. We can also look at urine and organic acid. This is going to tell us how these elements are breaking down. Are there parasites? Are there yeast? What is the balance of bacteria in the body? There's precise areas that we can tweak on somebody's internal compass that can make so many different changes. In addition, we look at some genetic profiles. Now, I'm going to tell you, I would not go crazy with this genetic testing. Some of the stories that I've heard when people are getting involved in genetic testing, we're taking it too far. Because it's going to drive you crazy. And if you're already in a stress response, you're going to make a decision based on what's driving your brain. Let somebody guide you. What would be beneficial to look at? We look at specifically MTHFR and COMT. This is the demethylation pathway and the pathway that is going to make your neurotransmitters in your brain. We are also going to look at the neurotransmitters in your brain because this way we are looking at the brain, we're looking at the gut, we're looking at the elimination system, and we're able to create a personal program that is going to make very valuable changes and get to the root cause of what is changing that child or that adult's physiology. So let's look at some of those stats.
The National Center for Health Statistics, which is sanctioned by the CDC.
Yes.
They did research on over the past 12 months for children under 18 years old. And look at these statistics.
Wow.
The M in each of these statistics indicates million. So for hay fever, 6.1 million children, that's 8.4% of the population of children under 18 years old suffers with hay fever.
Wow.
Respiratory allergies, 10% of children, almost 7.5 million children suffer and are being treated for respiratory allergies. Look at food allergies, 4 million children. Picture these children in school trying to eat
learn
what they're able to eat in a school setting. Look at skin allergies. 11.6% of all children under the age of 18 suffer with some form of skin allergies. And we know, because we've both had children, we both treated children and worked with children like this, those types of situations with skin allergies, a child can be dysfunctional. They can be rendered dysfunctional
Absolutely.
in the classroom.
Absolutely.
As far as trying to stay focused and dealing with the stress of having that.
Embarrassment too, socially.
Right, socially, that's a big issue. And now let's look at asthma. 6.3 million children have asthma. That's 8.6% of the population of children under 18 years old. And look at this number. 10.5 million children saw a physician in their office with asthma as the primary diagnosis in the past 12 months.
Wow.
These are huge numbers. Our children are suffering.
They are suffering.
Our children in our country are suffering. These are huge numbers.
This is just the tip of the iceberg of where these brain issues are really coming from. If the inside of my physiology is literally changing me, it's changing their brain. Now let's look at the gut outcomes. So this is what's reported. I always like to emphasize this is what's reported, right? So 15 million Americans have food sensitivities. This is what's diagnosed. So that's 1 in 7 children. What's really interesting is that what you were saying about being in school. So most of the time these kids, I'll find out, so what do you have for breakfast? They'll have something like a bowl of cereal, Lego my Eggo waffle, something that's really just a complex carb. And by 9:30, 10 o'clock, these kids are crashing. Learning has stopped within the first 45 minutes of school. Now, over the last year, there's a 74% increase in Crohn's disease. We also have found out statistically that the number of GMOs in processed foods from 1997 to 2008. Oh gosh, we're in 2016. I wonder where it is right now. This is the only data I could find on this one, but that's a 250% increase in the prevalence of autism in American children. So they drew a correlation between the rise in GMOs to the rise in autism with that particular article. And when we have these particular gut situations, and we're just skimming the surface, but we see eczema, vitamin mineral deficiencies, heartburn, indigestion, nausea, vomiting, diarrhea, constipation, lower abdominal pain, and this is increased body burden. This is what we mean by inflammation. So in order to really address the entire child or the entire person, you must look at the chemistry of the body. And that's the point of the webinar tonight. So what are those next steps that we want to do? As we discussed before, we want to really call to our parents. It's really time to step out. Look at what your child is going through. If any of this information is resonating with you, or you know a child, go to that parent, share this webinar with them. We are offering at no charge a 30-minute phone consultation just to see if perhaps we would be a good fit.
That's right. Parents know their children, and once they are in an environment, a phone call, a consultation, where they can start to talk other things, they're recalling other behaviors or patterns of behavior, and it starts to create a picture that to us is very valuable information to help their child. So please take advantage of that 30-minute free phone consultation at no cost to you.
And we'll give you our phone numbers in just 1 minute.
Now, if you're a teacher, you know that the dynamic of your classroom determines the outcome of your day. Did you have a successful day? Did you achieve the goals that you put forth? Did your class function as a cohesive unit? Was everyone happy, including the teacher, including you? Or did you have a happy day? Or was it stressful? Was it a day where you just, at the end of the day, you're exhausted? Your children, when they left, they're in distress. That's the thing we want to avoid. We don't want that. That's not
learning.
It's not learning. It's not happy. It's not good. What can we do for you? We love teachers. We want to help you. Our hearts are for teachers. We have strategies. Those strategies can help you address the concerns in your classroom, help you identify, is this a behavior problem? Is this a developmental delay? I have strategies for both of these things that can help create a more peaceful, calm environment in your classroom. So first 3 teachers who contact us, we would love to speak with you at no cost and provide your school teacher training where we can come in and we can address some of these issues for you and give you some of those strategies that can help you have a more peaceful dynamic in your classroom.
And then that just leads us to the school directors. We are really calling to school directors, and probably more in the private sector. But if you want to take your school to that next level, then we want to help you implement developmental assessments, because if we can do this early identification, early intervention, especially down at the preschool level, we can make horrific changes that are going to change the course of events for these children, that they will literally have optimal development rather than waiting, or even worse, that they would miss out on their fullest potential.
That's exactly right. And we combined, we have a wealth of knowledge and information that we would be happy to share with you. We can help you design something specific to your school, tailored to your specific school needs, a program that we can teach your school and your teachers how to roll out, or we can implement the program ourselves and do it for you. And that might be something that you might want to do for a period of time till you get comfortable with it, and then you can take it on yourself and incorporate it into your daily functioning year after year within your school.
Well, that's the thing I really like about us, Donna. We really are a very dynamic team.
Mm-hmm.
And one of the things that I think that we have a very special niche on is we want to meet your office, your school, your classroom, your home, where you are. So it isn't a cookbook recipe. It's about getting to know you and the needs that you have personally, either for your child or for the class or for your school. So here's how you get in touch with me and Donna. There is our website, BeTheFirstStep.com. There's my number, Dr. Laura Hanson, 678-787-3744.
And my number, Donna Anello, you can reach me at 678-938-6032. We'd love it if you would email us at BeTheFirstStep2016@gmail.com. And
be sure and like us on Facebook, Be the First Step, because our children really can't wait.
That's right.
Well, once again, it's Webinar Wednesday, and we thoroughly enjoyed being with you. And we look forward to seeing you next week at the same time. Have a great rest of the week.
Thanks for joining us.